Anyway, that's really I would say a different story. That history is very, very well documented. The only issue that Chris does not deal with in his book, and we allude to it, and that is 1 year before the U.S. Public Health Service endorsed fluoridation in 1950, which is a crucial year. We spend 2 chapters looking at 1950 and all the events surrounding it. But one event was that the sugar lobby, representing 130 odd sugar interests, said in its journal, we need to find a way to reduce tooth decay without reducing sugar consumption. Now, that was 1949, and the U.S. Public Health Service endorsed fluoridation in 1950. No one's ever joined the dots between those 2 events. Whether the sugar lobby was actually twisting the arm of the U.S. Public Health Service, we don't know. What we do know is the sugar lobby put a lot of money into nutrition departments at famous universities like Harvard, and millions of dollars into the nutrition departments, and the scientists. The chairman of the Harvard Nutrition Department was a gentleman called Dr. Frederick Stair, and he went around the country for many, many years extolling the virtues of fluoridation, how it was good for teeth and good for bones. It was more important for adults than children because it strengthened our bones, according to Frederick Stair. And he was also telling us that Coca-Cola was a nutritious drink, and cookies and other things. No, in testimony, in comments, he was saying things like this.
Incredible.
So that the twin-pronged approach of sugar is good and fluoridation was good, and also started this vitriolic attacks on any scientist. When you see the tracks, you see the verbiage that came out of this man's mouth when people were opposed to fluoridation, he would attack them unmercifully. And I'm sure the citizens and scientists trembled when he opened his mouth. He was very eloquent, but he was very nasty. And this hasn't changed for 60 years. There are people out there to this day, people like Michael Easley, people like Stephen Barrett, people like Jason Armfield in Australia, and they just go after opponents. And the object of the exercise, I believe, and this is my opinion, is to keep scientists and to keep doctors and to keep dentists away from the literature. Because if you read the literature, it's obviously unacceptable. It doesn't work. It doesn't work to reduce tooth decay on the one hand, or it's very, very small benefit, if at any. And 2, there are serious health questions. But they've kept the people away from the literature because they're too frightened to deal with this intimidation that takes place when they open their mouths. The American Dental Association in the past has been very intimidating when doctors and dentists have spoken out against mercury amalgams on the one hand and fluoridation on the other. In some cases, dentists have lost their state licenses to practice and that kind of thing. So that's what people have to understand this. They say, well, most scientists do this. Most scientists believe this. Well, most scientists are not involved. It's only a handful of people in the dental lobby and in the government that are involved in this. Most people, other people, have been kept away. That's why this book, in my view, is so important. It took me, it's 15 years of research.
I can tell there's 15 years. I have 2 questions now.
Yeah.
1, the FDA does not do clinical trials about fluoride.
Yeah. Wait, let's go back a second. With 3 agencies. Okay, let's deal with 3 agencies. 1, the EPA does not regulate water fluoridation. It only regulates the contaminant levels of fluoride. Secondly, the FDA has never regulated fluoride. Its official classification for fluoride, either as a prescription drug, over-the-counter or prescription drug, tablets, fluoride tablets, and water fluoridation, is that it's an unapproved drug. So here we have a medicine, which is the most prescribed medicine in American history, and it's never been regulated by the FDA. And so, therefore, there's never been randomized clinical trials that the FDA would normally require for any other drugs. Randomized clinical trials, definitely for effectiveness and also for safety. These have never been done. So again, look at it. EPA is not regulating fluoridation, and in fact is destined to protect fluoridation. FDA has never regulated fluoride for ingestion or water fluoridation. And it's left to the CDC, and this is only the 30 people called the Oral Health Division who have a mandate to promote fluoridation. And when it comes to health, they direct you elsewhere. If you ask the Oral Health Division, well, where are your staff? Where are your toxicologists? Where are your doctors? Where are your specialists looking at health effects? They don't have them. They'll send you somewhere else. They'll send you to a review, which is 5 or 10 years out of date. It's unbelievable. So there's no one regulating this thing in the United States. There's no one actually at the federal level responsible for fluoridation. It's been outsourced to private entity. If you could explain some of these things to me.
Well, wait a minute. Let's go back for just a minute. The National Sanitation Foundation.
Yes.
60 years they've been experimenting with fluoride. How do they come into the fold? That was a little confusing for me.
Well, it was if you go back to it was about the 1980s. I'd have to check the dates, but it basically about the time that the EPA washed its hands of regulating additives to water. That was the time that they helped to set up this National Sanitation Foundation to be the agency responsible for monitoring the standards or determining the standards and recommendation for the levels of chemicals used in drinking water. So you have the NSF, ANSI standards for a whole bunch of things that are added to the water, including fluoride. So basically, it was outsourced. The EPA outsourced, and the FDA between them, cutting deals between them, outsourced this to the NSF, which is brilliant because now you don't have any federal agency in charge of the toxicology of fluoride or responsible for the toxicology of fluoride or for the chemicals. And in fact, if today a public official was to ask the NSF, that's supposed to have supposed to be the final resting place for the safety and accountability on fluoride, and you ask them for the toxicological studies on hexafluorosilicic acid, they refuse to give it to you because they don't have any.
So nobody's home, really. It's called nobody's home, and nobody wants to be home.
What is that trick where you have the 3 shell? It's the most brilliant shell game that's ever gone on with a public health policy. And it's the biggest, in my view, the biggest betrayal of the public's trust imaginable. And you've got to look at this from 3 levels, I think, in terms of the betrayal. At the ground level, you've got thousands, millions of doctors and dentists who don't seem to have any hesitation of going out to the public and saying that fluoridation is terrific. However, you will find that most of those people have not read the literature because they're so busy treating their patients. It's a very busy job being a doctor or a dentist. So they don't have the same time that 3 professors, retired professors, have had to study the literature. And I don't have a problem with that. What I have a problem with is having not studied the literature telling people it's safe. I think that's outrageous. And for that matter, effective. That's outrageous. But it's understandable that all they're doing essentially is passing on secondhand what they were taught at dental school and medical school, and what is now reinforced by repeated.
Well, it's brainwashing. It's basic brainwashing. You say it over and over and over until it's a fact, whether it is or not.
Absolutely. So the ADA, the CDC, and their minions is safe and effective, safe and effective, safe and effective. This is the most cost-effective way of treating tooth decay. This is the way of getting equity because it goes to everybody, blah, blah, blah.
Who benefits from fluoridating water?
Well, okay, first of all, and I'm not saying this is the most important, where the sugar industry has definitely benefited from the sidetrack of fluoridation. And of course, the phosphate fertilizer industry benefits because they're getting rid of the hazardous waste. But I would say the dental research community has benefited. Shortly after the trials of fluoridation began in 1945, this huge building was erected in Bethesda, Maryland, called the National Institute for Dental Research. And this huge research institute was built essentially on the back of of fluoridation. The fluoridation is the